Bronchitis represents the natural progression of the common cold or flu in most cases. Therefore, taking aggressive action at the first sign of a flu or a common cold is one of the best ways to prevent the progression to acute bronchitis. At the first sign of an infection, consider taking the following supplements. Take 2 zinc lozenges at 13 to 24 milligrams of zinc in each lozenge immediately, and again every 2 to 3 hours for the first day or two. Then slowly reduce the dose until the symptoms dissipate. Take 9 to 18 grams of garlic. In order to activate the allicin in the garlic, crush the garlic and leave it oxidize for 15 minutes and then consume it raw. If you don't already maintain a blood level of 25-hydroxy-vitamin D at over 50 nanograms per milliliter, take 50,000 international units of vitamin D the first day and continue for 3 more days. Slowly reduce the dose to around 5,000 international units. If you already take 5,000 international units of vitamin D, you probably don't need to increase the intake. The over-the-counter medication cimetidine is a heartburn drug, and it has potent immune-enhancing properties. People take 800 to 1,200 milligrams per day in divided doses. Melatonin not only helps sleep, but it also helps to enhance the immune system. A higher dose of 3 up to 50 milligrams at bedtime can be used. Don't delay implementing the above regime. Once a respiratory virus infects too many cells, it replicates out of control, and it potentially progresses, rendering strategies like zinc lozenges ineffective. Treatment needs to be initiated as soon as the symptoms manifest. Pelargonium is a botanically highly valued plant in the South African region as a remedy for several respiratory tract ailments, including acute bronchitis. Several studies have examined the efficacy of the root for the treatment of various respiratory conditions, many of which have shown promising results. Specifically regarding acute bronchitis, a number of human trials have found that Pelargonium is effective as a treatment option. In one randomized, double-blind, placebo-controlled trial, conducted on 406 adults with acute bronchitis, a herbal compound prepared from Pelargonium was significantly superior to the placebo in relieving the acute bronchitis symptoms. In a study that expanded on the findings from the same group of subjects, the benefits of the Pelargonium over the placebo were found to extend to improvements in the impact of the patient's sickness, the duration of the activity limitation, the patient-reported treatment outcome, and the satisfaction with the treatment. One of the first major studies to examine the effects of Pelargonium in adults who had acute bronchitis was published in 2003. The participants received 30 drops of the formulation 3 times per day, or placebo, for 7 days. In the study, the extract was superior to the placebo in reducing the severity of bronchitis and in shortening the duration of illness, with no serious adverse reactions reported. A study on 200 children and adolescents aged 1 to 18 with acute bronchitis showed the Pelargonium administered in a liquid extract for a 7-day period at 30 drops per day for children aged 1 to 6, and 60 drops a day for children aged 6 to 12, and 90 drops a day for children aged 12 to 18, was significantly superior to the placebo for relieving the acute bronchitis symptoms. In separate randomized double-blind placebo-controlled study, 217 adults with acute bronchitis received 30 drops of the formulation 3 times a day, 30 minutes before or after a meal, or placebo for 7 consecutive days. The liquid extract of the Pelargonium was superior to the placebo for improving the scores on a standardized bronchitis symptoms assessment, such as relieving the specific symptoms like cough, chest pain upon coughing, sputum, and shortness of breath. Moreover, very good subject satisfaction was seen in the study. German researchers studied the effects of Pelargonium in 2,099 people with acute bronchitis. In this study, the formula was administered 3 times a day, 30 minutes before a meal for a 2-week period. The study found the average symptom scores decreased significantly across the study group. Moreover, only 26 subjects reported an adverse reaction to the treatment regime, none of which were serious. A different study, published by a group of scientists in Russia, examined the effects of the Pelargonium versus a placebo in a double-blind, randomized trial on 124 adults with acute bronchitis. These participants received 30 drops of the formula 3 times per day, or placebo. Results of a standardized assessment after 7 days of treatment showed the Pelargonium was superior to the placebo for the relief of the acute bronchitis symptoms, with nearly 70% of the subjects responding to the treatment within the first 4 days. Lab studies indicate the Pelargonium mix acts through multiple mechanisms that help to fight the respiratory tract conditions. First, it possesses anti-infective properties by increasing phagocytosis, which is the mechanism used by the white blood cells to remove pathogens and cellular debris. And second, the infected cells treated with the Pelargonium showed augmented activation of defense mechanisms. And finally, it was found to stimulate ciliary beat frequency, and this helps to clear the excess mucus. Thyme extract is a promising therapeutic option for the cough that occurs in acute bronchitis. A double-blind, placebo-controlled study used extracts of a combination of thyme leaf and primrose root to assess their ability to reduce the cough on an objective scale, the bronchitis severity score. On days 7 to 9, an average decrease of over 67% in coughing fits was seen in the thyme primrose group. A 50% reduction in cough was achieved by the extract combination treatment, approximately 2 days earlier compared to a placebo. In another double-blind study, 361 people with acute bronchitis received a thyme IV combination for 11 days. Researchers reported that its administration was superior to a placebo for a reduction in coughing fits. Another study examined a herbal combination that included thyme extract. The authors reported that thyme extract was as effective as synthetic medications for the clinical outcomes of bronchitis in children and adults. In the adult subgroup, there was a tendency for better results and less adverse reactions with the herbal combination when compared to the synthetic medication. N-acetylcysteine is a slightly modified version of the natural amino acid cysteine, and it's both mucolytic, which means it can break down or thin mucus, and has antiviral properties. The N-acetylcysteine has been shown to inhibit the replication and to ameliorate the inflammatory reaction that's caused by influenza virus and other respiratory illnesses. In experimental studies, the N-acetylcysteine significantly offset the oxidative and inflammatory stress through multiple mechanisms, and it also decreased the severity of the influenza symptoms in animals and humans. N-acetylcysteine is also thought to inhibit the intracellular signaling pathways that promote viral propagation. In addition, the N-acetylcysteine is a precursor to glutathione, a potent antioxidant. A small-scale placebo-controlled trial for the treatment of serious inflammatory symptoms inflicted by mustard gas inhalation showed 1,200 milligrams of oral N-acetylcysteine daily for 4 months significantly improved the respiratory function in the control group. Another trial showed 1,800 milligrams of N-acetylcysteine daily for 4 months improved cough, shortness of breath, and sputum production. In a double-blind, placebo-controlled trial, the mucolytic activity of N-acetylcysteine was evaluated in 215 people with bronchitis, 84 of which had acute bronchitis. Subjects were given 200 milligrams of N-acetylcysteine 3 times per day for 10 days, along with antibiotic therapy. The N-acetylcysteine was found to be significantly more effective than the placebo for the reduction of cough, sputum volume, and viscosity. Inhaled eucalyptus essential oil has been used in traditional medicine to treat respiratory disease, including bronchitis. These essential oils have antibacterial, antiviral, and antifungal activity against pathogens that are implicated in these conditions. Essential oils contain many constituents, including compounds called monoterpenes, and these are thought to be at least partly responsible for the antiviral properties. The eucalyptus monoterpene 1,8-cinol has been found to significantly decrease the signaling activity of NF-kappa B, a master pro-inflammatory molecule. NF-kappa B activates the production of many inflammatory molecules in response to an infection. Inhibitors of NF-kappa B, which is part of a signaling pathway that the influenza virus can hijack after infecting human and animal cells, were shown to protect the animals against highly pathogenic influenza viruses, and this molecule might become a target of novel anti-influenza drugs. One combination of essential oil monoterpenes that includes 75 mg of 1,8-cinol in combination with limonene and alpha-pinene has been found to be effective for acute bronchitis. In a double-blind, placebo-controlled clinical trial, 676 people with acute bronchitis were given either 300 mg of the combination 4 times per day, antibiotics, or a placebo. The researchers reported signs and symptoms dissipated more rapidly and more completely for those who were taking the essential oil combination than those in the placebo group. The authors concluded the combination of the essential oil constituents is well evidenced alternative approach to antibiotics for acute bronchitis without specific infective agent, without the risk of promoting the development of the bacterial resistance. In a 2013 multi-center randomized control trial, it found that coughing fits decreased 62% after 1 week of treatment with the combination. In addition, there was less daytime coughing fits, difficulty coughing up, and sleep disturbance due to nighttime coughing when compared to the placebo group. There's evidence that supplementation with vitamin E can improve or exert a protective effect upon lung health. Supplementation with gamma tocopherol, an important form of vitamin E, decreased the overall oxidative stress, and it suppressed the excessive release of inflammatory chemicals from the white blood cells of healthy and asthmatic human subjects. Gamma tocopherol also showed anti-inflammatory effects in the upper airways of an animal model of allergic rhinosinusitis. A mouse model of airway inflammation caused by nitrogen mustard gas revealed that vitamin E decreases acute lung inflammation and it inhibits collagen formation in the lungs. In addition, a study reported there's a benefit when incorporating vitamin E into pandemic influenza vaccines as an adjuvant, i.e. a substance added to the vaccine to enhance their immune response. One such adjuvant containing vitamin E as alpha-tocopherol is known as ASO3, and in a trial on 1,340 healthy individuals who were inoculated against the pandemic H1N1 influenza virus, those who received the vaccine with the ASO3 achieved the strongest immune response against the virus. Curcumin is derived from the spice turmeric, and it's a natural anti-inflammatory agent. Curcumin has an established role in protecting lung tissue against inflammation induced by chemical and infectious agents. Curcumin was shown to reduce the inflammatory response in the lung epithelium of mice. In a study on 2,478 Asian adults over the age of 55, a dietary intake of curry containing curcumin at least once per month was significantly linked to better lung function, even in current and past smokers. Bromelin is an extract of the pineapple plant. It has anti-inflammatory, immunomodulatory, and mucolytic properties. Bromelin is a collective term for the enzymes found in the pineapple. These enzymes are proteolytic, meaning they break down proteins into their constituent peptides and amino acids. Bromelin might offer therapeutic benefits to individuals who are suffering from bronchitis and sinusitis. For more on herbs, supplements, and natural treatment plans, check out my website.